Hi, I am one of the pediatric surgeons at UCSF Benioff Children's Hospitals. I wanted to take some time to explain a little to you about your child's diagnosis, how we will treat it, and what you can expect before and after your child's procedure. Based on the tests we have performed and the history you provided, we think your child has acute appendicitis. I'm going to draw some pictures to help explain what it is and how we treat it. If this is your abdomen, you have your ribs up top, the pelvis on the bottom, and the belly button in the middle. Inside, you have small intestines, which connect to your large intestines, also called the colon, so you have one very long tube on the inside. The large and the small intestines join together on the right side of the abdomen. This is where the appendix lives. It's like a little tail that hangs off of the intestines, and it doesn't serve any purpose. When the appendix becomes infected, we call this acute appendicitis. This can happen because a little piece of food or poop gets stuck in the appendix and blocks it from draining. This causes the appendix to become swollen, inflamed, and then infected. If left untreated, the appendix becomes like a water balloon that can even rupture or pop so the infected fluid can leak out. Appendicitis is very common and there's nothing you or your child did to cause it. When the appendix first starts to go bad, it can cause fevers, decreased appetite, diarrhea from irritating the colon and large intestines, nausea or vomiting from bothering the rest of the intestines, and most commonly pain in the lower abdomen, which can be worse with walking or moving the leg by irritating the muscles that control your child's hip. Once we think someone has appendicitis, starting antibiotics is the most important thing. Antibiotics alone may be used to treat appendicitis in some places and will keep things from getting worse while waiting for surgery. Here at UCSF, we often recommend surgery to help reduce the risk of having appendicitis again. If caught early, we can usually take the appendix out laparoscopically, which means using 3 small incisions or cuts to insert a camera and fill the abdomen with air. We then use instruments skinnier than a pen to take the appendix out through the belly button. If the appendix has not ruptured, we will let your child eat and drink and hopefully be able to go home within a day of surgery. Your child will be allowed to move around and shower the day after surgery and go to school within a week, but they should avoid strenuous activity or organized sports. Please look at your child's discharge paperwork for detailed information about restrictions, pain medication, and reasons to call or return to the hospital. While complications are less common after a non-ruptured appendix is removed, they can happen and it is important to call with any questions or concerns. Unfortunately, a lot of children present to the hospital after the appendix has already ruptured. This is common because kids are not able to tell us exactly what is causing their pain and can present to the hospital a little late. We will not know for sure if the appendix is ruptured until after surgery. This is important because a lot of what happens after surgery depends on whether or not the appendix has ruptured. If your child has a ruptured appendix and is able to get surgery, your child will need to stay in the hospital for more antibiotics after surgery. This is because when the appendix ruptures, bacteria or infected fluid from the appendix spill out into the abdomen. We do our best to clean up any of the infection during surgery, but count on antibiotics to help. Infections after surgery can happen at the surgery spots where they turn red or inflamed, or the infection can be inside the abdomen in what we call an abscess or a collection of infected fluid. If either of these things happen, it might mean your child needs to stay in the hospital longer than expected for antibiotics, to support their nutrition, and sometimes to do additional procedures to drain the infected fluid. Again, if any of these things occur, your surgical team will discuss the options in more detail and are always happy to answer any questions you may have. In some cases where the appendix has ruptured, things are so inflamed inside the abdomen that we think it is safest to treat the infection first with antibiotics and do surgery once this has improved. If we think there's a lot of infected fluid in the abdomen, sometimes we will place a small tube to drain the infection and help the antibiotics do their job. We do not expect your child to be in the hospital for the whole time they are waiting for surgery, but it is hard to predict. Our goal would be to take the appendix out around 6 weeks after the appendicitis started or when you first came to the hospital. If your surgeon does not think it is safe to do surgery at this time, they will talk to you about the options and why in more detail. Please stop us and ask questions if you have any.